Women who are pregnant have the same chance to obtain a sexually transmitted infection as those who are not pregnant. Sexually transmitted infections are crucial to take care of even without a person being pregnant. But getting infected during a pregnancy is a really big deal. The cause of a sexually transmitted infection comes from sexual activity with an infected partner through vaginal, oral, or anal sex. The culprit of a sexually transmitted infection is a virus or a bacteria. Some examples include chlamydia, genital herpes, gonorrhea, hepatitis B, or syphilis. A mother can pass her sexually transmitted infection onto her baby, either through vaginal birth, or through the placenta, or through breastfeeding. Examples of infections that can be passed through the birth canal are chlamydia, gonorrhea, or herpes. Examples of infections that can be passed through the placenta are syphilis or herpes. An infection that can be passed through breastfeeding is the human immunodeficiency virus. In order to prevent yourself from getting a sexually transmitted disease, there are a number of things that you can do. Limit the number of sexual partners that you have in your lifetime. Also, make sure that all of your sexual partners get tested for the STDs before you engage in any sexual contact. Abstinence is the only 100% way to protect yourself from any sexually transmitted infection. If you do engage in sexual contact with somebody you are unsure that has an STD, use preventative methods like condoms. Know the common signs and symptoms of STDs so that you know how to spot them if you see them. Treatment may vary depending on the STI. Antibiotics do a great job of getting rid of any non-viral bacterial infection. If the mother does pass down her sexually transmitted infection to the baby, there are some antibiotics that are safe for both the mother and the baby. However, viral infections like HIV or HPV cannot be cured with antibiotics. If a woman does have a virus during her pregnancy, it might be recommended that she take an antiviral medication. Sometimes when you have an STI, there are no symptoms at all, but when there are symptoms, they may include bumps, sores, or warts near an area that has come into sexual contact, skin rash, painful urination, weight loss, loose stool, night sweats, aches, pains, or chills, jaundice, penile or vaginal discharge with or without an odor, irregular vaginal bleeding, painful sexual intercourse, and severe itching of the genitals. So what happens if a mother does pass her infection onto her baby? Well, it could result in premature birth, stillbirth, organ failure of the baby, chronic carrier of the virus, low birth weight, premature rupture of the membrane surrounding the baby in the uterus, eye infections, or skin warts. About 19 million new infections occur each year, and almost half of these infections occur in people ages from 15 to 24. Women, especially African American women, have a higher risk at getting these infections. About 1 in 4 females have a sexually transmitted disease. Louisiana is ranked the worst state if you want to avoid an STD. It's ranked 4th for chlamydia, 2nd for gonorrhea, and 3rd for syphilis. However, West Virginia is ranked the best state if you'd like to avoid an STD. It's ranked 48th for chlamydia, 41st for gonorrhea, and 49th for syphilis. When it's all said and done, it all comes down to you. Stay safe, stay smart, and stay healthy.